Hi, my name is Denise Richards, and I am a registered nurse. I am currently based in Florida. However, I'm a UK citizen living in the United States of America. I was born in the island of Jamaica, and that's where I did my nursing before migrating to the UK. I am currently doing travel nursing. I've started travel nursing since last year in July, somewhere around July 2021. I would say as a child, I was very ill, and so I've been in the hospital in and out. I know that I was always impacted by the presence of the people in white. And later on, I get to understand the difference between the doctors and the nurses. But it was always amazing how kind they were. And so as a result, somewhere in the back of my mind, I lodged it that, yes, I would like to be one of these people. Specifically, I would love to be a nurse, to look after people and get to let them feel better, because that was my experience as a child. So I decided on travel nursing after much poking from my colleagues. I was working as a uh, Yes, I was working as hospice nurse, and there were quite a few of us in hospice nursing. And then when the COVID period started and a lot of nurses kept lefting, we felt very overwhelmed in our position, as staff nurses. It was almost like we had to beg for time off, just all of that. It had become a very overwhelming situation. So quite a few of my colleagues had left and were traveling, and so they kept telling me about traveling nursing, and it was a difficult decision to make because I have my family, and I did not this did I really didn't want to disrupt my regular family life and its setting. So it was a difficult decision to make, but yeah, 1 year later, I am quite happy I made the move. COVID was a very, very difficult period. I think we're still experiencing the repercussions of what COVID brought to our career and, the people that we have to care for. So during the COVID period, it started out with us not having sufficient PPE to visit our patients, and I do home health. So I had to go into people's homes, whether they were positive or not. So, I mean, patients were fearful of us coming into their homes because of what we may bring to them. And as a result, and likewise, we were worried about going into homes where patients or family members were tested positive. So, it was a back and forth situation between us and our patients. Um, so I mentioned about not having the required PPE to go and see these patients. And then there were situations where we had to be using masks repeatedly, which we found quite unhygienic and unsafe, not just for ourselves, but for the patients as well. Um, Besides that, there was a lot of, you know, information that was floating around that was not even medically based. So it was just really difficult for us. People were not welcoming, and in instances where we had to go out to see COVID patients not fully equipped, we were worried about what we would be taking home to our families, and we were taking on ourselves. I would really say that the benefits of travel nursing for me as an individual is that a 13-week contract is something that I can really do. I have a time frame in mind when it's going to start and when it's going to end. So as a result of that, I'm able to plan other things around the time frame when it's going to end or when it's going to start. The second thing is, when I lived in England, I managed to get a certain amount of holidays. Here it's a little less. So I find that a little bit challenging because, of course, I have the kids, and travel nursing does allow me to have that because after an assignment, I can decide to take 1, 2, 3, 4 weeks, even more if I want to. So it's not like I'm working for an employer where I am expected to be at work. It's a case of I say when, and once the contract is ended, I can decide to stay out for a few months and jump right back in. So those are the perks that I think travel nursing has afforded me. The second thing is, I find that there are situations where you work in settings where you're not very comfortable. Your colleagues may not be the nicest, and when you're working full time in a setting like that, it's like you're forced to stay there amidst, sometimes even toxic situations. For me, I can keep my head down, I can stay focused, get my work done for 13 weeks because I know at the end of 13 weeks, I'll be gone. So I can endure. I can endure whatever is going on for 13 weeks. So I think some of the disadvantages is some of them are rumor oriented. There's this thought pattern that traveling nurses make a whole lot of money and we have to be training them up. That's a perspective of a whole lot of nurses who are employed. We have to train them up, we have to support them for 13 weeks, and they get to take home the big pay package, which is not always the case. I would say travel nurses that works in emergency situations, like for example, a state is under strike or a state is overwhelmed and they may call out and ask for travel nurses. Those are the ones who makes the big bucks. Otherwise, travel nurses make um, somewhere around a good pay package, but a lot of it is your per diem payment, which allows you to stay in a hotel or so. The second down thing I find about it is that employers do not invest in you because you're not a long-term employee, you're very short-term. So if there's training or anything that will enhance you as an individual or as a nurse in your profession, then you will not be privy to that because you're not a long-term investment for this company. um, the third thing I find, it can turn out to be a little bit lonely because the other nurses knows each other. You are quite new. It's not always the case, but I have experienced that. So other nurses know each other. They have their cliques, they have their friends, and sometimes you can be left out on a limb. Yeah. So you are quite liable to float as an as a nurse, as a traveling nurse, as opposed to a regular nurse. If floating is going to take place, more than likely it's going to be you. Yeah. So in Jamaica, you can have a situation of anywhere between one nurse to 30 patients. Yep. And probably just the assistant of an aide to help with feeding, giving the patients their meals and helping with baths and any hygienic processes. So that's the situation in Jamaica as a nurse. So I worked the emergency room when I was in Jamaica. So it was a little bit different. I worked the operating room and the emergency room. So those were my two settings while I was in Jamaica. It's a little bit different because we have a team of nurses, doctors, that works in the emergency area. The operating room speaks for itself. It's a little bit different, so you don't have that setting. Um, However, I really liked it. People were very appreciative. We would have situations where these patients would, or patients' families, they don't have money to give you, but then you could turn up on a day, a bag is handed to you, and in there it's like ground provisions, it's like plantain, it's like yam, it's cocoa, whatever they dig from their grounds, that's what they bring to, just to show their appreciation for what you've done for them or their loved one. So, very appreciative setting, even though the fact was that, we were always short staffed. We don't have the modern technology to use as in when I went to the UK. So that was another situation now. In the UK, we had all the gadgets, we had all the modern equipment, um, and then we had the NHS. So people do not end up like paying out of pocket for their health care. I think that there's a different way of accessing or that money being pulled, to use for their health service when the time comes. So that was we had shortages, but nothing as severe as when I was in Jamaica. And then again, I worked the emergency room, so I've never been on one of the ward situations in the UK, but I know in the emergency room things pretty much flow well. And I have already mentioned about the National Health Service. Now moving to the US, it's like a completely different situation altogether. It's what rules here is health insurance. Health insurance allows you to be able to be seen in the emergency room and just by your primary care physician. So you don't have that in place. I find there are so many complaints about patients who will say that, or people in general who will say, I have this going on, I have that going on, yet I cannot get to go and see a doctor because I don't have health insurance. That was a little bit shocking to me coming from the UK, knowing that, healthcare was accessible. People could just go and to a healthcare setting and get seen. They could register with a primary care physician. And it's kind of a little bit sad in my view. I feel sad about it because there was one situation where I had to go into my pocket between myself and my husband. We decided on helping one individually to obtain, we call them the plurvax. So it's material, it's bottles that we use, and the patient has a tube in her lungs, and I would use that 3 times per week to pull fluids off her lungs. Now this patient was like holding back, not wanting me to come and visit her because she said she had run out of bottles, and two, the health insurance that she had in place was not covering it. And I was screaming in my head, is this even possible? I said, who is the mayor? Who is who runs this place? Who is the governor? I really wanted to step outside of my realms as a nurse and speak up on behalf of this patient. So, I came home and I was just complaining to my husband, who is a nurse as well. And he said, let's look online. Let's find out how much it cost. And we found out the cost. And it was a little bit over $1,000, but it's something that we wanted to do to help this patient. So we bought her a box and we had it delivered to her house so she could carry on with her treatment. And this is not a one off scenario. I mean, us coming out of pocket is a one off scenario, but the fact that people are unable to access the help they need, or they may access it but not the whole way, is a general situation, and for me it's really very sad. It's a big issue here in the healthcare system. The second thing I would say is, the magnitude of the notating that nurses have to do for Medicare and Medicaid benefits, it's just highly ridiculous. It's almost like our time spent with patients have been cut down to the bare minimum. For all this notating, one of our visits could end up being a ratio of 80% notating for Medicare and 20% of seeing the patients. And again, I just find it a big turn off situation. Turn off to the point where I said, if I could spend another 10 years in nursing, that would be cut by half. Just the fact that, you know, all this notating and writing and ticking boxes on a screen. And this doesn't necessarily end at work. Sometimes you have to carry this home with you, and it becomes part of your like a homework situation. Yeah. So I just find the three comparisons just so highly different, where in the other two worlds there was, a lot of hands-on with our patients. Here it's notating. I strongly believe that there are a lot of nurses who feel this way. In fact, I've been nursing here for the last 6.5 years, and nurses are leaving the healthcare system in the droves. And, it's because of, um, some of the factors that I just highlighted. Um, we are nurses. We were trained to do hands-on work. Many times we realize that even concerns that we raise about our patients, it's almost like it goes on deaf ears. We believe that the people who are standard setters, or so to speak, they would probably name themselves. I think a lot of these people have lost touch, if they ever had any, with working at the bedside, seeing patients. I think once people come out of that kind of atmosphere, the main drive is not patient care and um, quality care being given to patients. It's said so many times that it has almost become cliche. And us at the bottom of the rung, the nurses, the nursing assistants, we see that this is really not the full picture. This is not the truth. Um, there are instances where nurses decide to speak up on behalf of their patients. I know I have had a lot of run-ins with people, who are so to speak, at the in leadership positions in our um, offices and in our businesses. But I would I don't know if there's any joint group right now, and if there is, I would most definitely like to become a voice for the patients, because I have been, felt hurt many a times for the patients when I hear their stories, and when you feel almost helpless in what they're telling you, and you don't know what else to do. So I do believe it has become a great issue for a lot of the nurses and even those who are stepping away. One of my goal right now that I'm currently deciding to pursue, and that is, um, so I am a writer. I have one book published, and I would really like to write for be a nurse writer. So that's something I believe I'm going to pursue at some point once I manage to probably work less. And secondly, myself and a few of uh, my fellow nurses, we're putting a YouTube channel together so that we can advise young nurses. That's something that we would like to do. We would like to be there as a source for new nurses, younger nurses, because at the end of the day, even if we are leaving the profession, we still need very good nurses. And that's an area which I have realized that the times have changed, and the things that nurses used to do have significantly moved away. I would like to just encourage younger nurses to keep that standard going, and that's what we'll be working on as a channel on YouTube that's very accessible. Hmm. I believe at this junction, I can truly say I am part of a great group of people who are dedicated. They have given themselves. I have tried to change my profession more than once. I must let you know that. When I moved to England, I applied to med school. I was placed on a waiting list and I ran out of patients. So I applied to law school and I did my postgraduate diploma in law there. So, and I did 3 years of voluntary service as a legal advisor, and I could have traveled on in that direction, except I came right back to my first love, nursing. And I must say that nursing has taught me to become dedicated. It has taught me compassion beyond what I thought I already had. It has taught me to be selfless. I think that's what stands out the most, to be selfless, because there are times when I am looking at the clock. I know my shift is going to come to an end soon, but then there is somebody sitting right in front of me or lying right in front of me that needs me now. And so I go beyond hours. I don't, I go beyond what the clock is showing me, and I just show out for, one of these patients. So I think beyond everything else, it has really, really taught me to be selfless, and you can't get any better than that, can you? No, I would not change anything. As I said, I tried on 2 occasions to give up nursing, and I made a 360 and came right back to it. I also schooled my children for 5 years, so I was really out of this, system for 5 years. But immediately, as the time was right and my kids went off to school, I came right back to nursing. So I have certificates in other disciplines that I could have tapped into, but for me, I think nursing is larger than us. It's really big. It's you will never. It's a royal and a loyal, noble commitment that you make when you decide to become a nurse. So, being part of this that's really bigger than I am, no, I don't think I would change anything. An aspiring travel nurse, and in fact, I had to do that just last week because one of my colleagues came up and she wanted to know, what are the perks and what are the downs to travel nursing. I would say go for it. If you're thinking about it, go for it. If it's not for you, you will immediately pick that up. If you're like me and you were wondering about it, because I was totally scared. I said, if I give up my full-time job, will they be able to keep finding me assignments after assignments, each time one is completed? That was my worry, and yeah, 1 year on, I can't complain. It's been good. My company is a very good one, and I would just say, give yourself the opportunity. Go for it. Try it and see. At least you won't be sitting there somewhere in the back of your head and said, "I would have loved to." You would have done it. No, not really. I would just say to those who are considering travel nursing, go for it. Um, to our nurses who feel tired and weary, keep going, and you're doing a good job. And one day you will see the rewards of your goodness.